Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Miliary shadow in chest X-ray. Now we'll be looking at its causes. So miliary shadow, it basically refers to the innumerable small pulmonary nodules. So it is nothing but the innumerable, and it is small, and it is nothing but the pulmonary nodules. It is the pulmonary nodules. So here, what by small? The small we refer to the size of 1 to 4 mm, and they are scattered throughout the lungs. So it is scattered throughout the lungs. And where are these conditions seen? So the miliary shadow, it is seen in terms of the miliary tuberculosis. So this is very important, MTB. Next is the histoplasmosis, and also in terms of the sarcoidosis, the pneumoconiosis, and the pneumoconiosis, it refers to the coal workers pneumoniosis as well as the silicosis. So the coal workers pneumoconiosis as well as the silicosis. Next is, it includes the healed varicella. So there is a healed varicella. And next is, there is a long-standing MS. There is a long-standing MS. So the long-standing MS, it can lead to the pulmonary hemosiderosis. So this leads to the pulmonary hemosiderosis. And next is the presence of the alveolar microlithiasis. So there is alveolar microlithiasis as well. So in this case also, there is a cause of the miliary shadow. And then there is a papillary. So there is a papillary as well as a medullary carcinoma of the thyroid. So carcinoma of the thyroid. To learn and grow daily like this, please do subscribe.